Hey guys. Hi, thanks all for joining. Yes, everybody set their alarms for exactly 1 p.m. That's good. I'm just going to give it a couple minutes for more people to join and we'll get started. Hi. Thank you, Odessa. Hope everyone's having a good Saturday. I'm just going to give it one more minute. Hi, Valia. Hi, Dumpson. Nice to see all of you guys. You're welcome, Shavina. Hi, Lorena. Can you guys all hear me okay? Hi, Meredith. Okay, good. I'm glad you guys can hear me. That's what I was waiting on. All right, so I'm gonna get started. My name is Ohara Aivaz. I'm a board certified dermatologist working in Beverly Hills. I do both medical and cosmetic dermatology, and I'm really excited to be here today to talk to you guys about skin wellness. I got a ton of questions from you guys, so thank you so much for sending those in. I have a little outline I prepared to make sure I go through everything you guys wanted me to discuss. So to begin with, I'm just going to start about some basic skincare tips. Anybody who knows me knows I'm obsessed with sunscreen. I don't leave home without it. So I wanted to talk a little bit about sunscreen first. Everybody should be wearing sunscreen, SPF 30 or above, every morning on anything that's exposed. So I think we're all good about putting sunscreen on our faces. It's really the neck and the chest and the tops of the hands that we forget, and these spots get a lot of sun throughout the day as well, especially when you're driving, so make sure you're using that. And even though we have olive skin or darker skin, it doesn't matter. We're still prone to ultraviolet light damage that can cause wrinkles and freckles and skin cancer. Nobody wants those. So if you're going to be going out to a barbecue or the beach, then I recommend SPF 50 or above, and you want to reapply every 2 hours, especially if you're sweating or getting wet. I wanted to show you guys some of the sunscreens that I really like. Elta MD is a great one. It's a medical grade sunscreen that stays very well, and this is what I use typically when I go outside running or jogging. My other favorite one is Neutrogena. This is a drugstore brand. Ultra Sheer is the name. It blends in really, really nicely, and this is one of my favorites too. Okay, so for my ladies who are wearing makeup when they're out and they don't want to reapply their sunscreen, a company called Color Science makes a really great powdered sunscreen with a brush applicator tip, and this is really nice because you could just brush it on over your makeup, nothing gets ruined, and your skin is still protected. It comes in a variety of colors too, so it's good for all skin types. Don't forget your hats when you're outside and your sun protective clothing. So I always go out jogging and I wear a long sleeve shirt that comes up high on the neck, and there's a built-in UV protection factor for those types of clothing. You can buy those at Walmart or Target or online. I'm gonna post this video again, so you guys will be able to see all of these products in the video, and I can link some products in the caption to that video, so don't feel like you have to frantically write anything. Okay, so I got a question on chemical versus physical sunscreen. So chemical sunscreens are oxybenzone, avobenzone. These are typically what's out on the market for sunscreens. And they work basically by scattering the UV light that hits the skin. And then there are physical sunscreens that contain zinc and titanium, which are a bit more on the natural side for sunscreens. These work by basically reflecting the sun off the skin, so no ultraviolet light gets absorbed into the skin. These sometimes don't blend as well, and it really doesn't matter which one you use as long as you are using the sunscreen. So just find something that works for you and stick with it. All right. The other two things I wanted to talk about with sunscreen, one is spray sunscreens. I'm not crazy about these. I see people at the beach all the time kind of just spraying themselves and then laying out. But when you're spraying yourself, half the sunscreen kind of goes out into the environment, and you're not getting as much sunscreen as you think. So really try to use creams or lotions. Use a spray if you're having trouble getting your back and you don't have anybody to apply there for you. And lastly, when you're driving, important to cover up your hands. So yes, sunscreen helps with that. People who know me know I always drive with gloves. It's not cute, but your hands will thank you in 30 years when they're spotless. All right, so that is sunscreen. The next tip I wanted to talk about, just for general skin wellness, is smoking. Sorry for all my hookah lovers, but smoking and cigarettes are horrible for your skin. They basically constrict the blood vessels that supply your skin, so you're not getting the oxygen or the nutrients that your skin needs to stay healthy. Smoking is also the only thing that, if used correctly, will actually cause cancer. Lung cancer, skin cancer, bladder cancer, you name it. So don't do it. All right, next, important to maintain a healthy diet. Fruits and veggies and nuts, they all have vitamins, minerals, phytonutrients, which are amazing for your skin. So vitamins A and C are building blocks for collagen. So if you don't have the building blocks that you need to make collagen, your skin is not going to stay plump and nice. And we all need collagen in our skin to stay as youthful as possible. So make sure you're getting a good amount of veggies and antioxidant-rich fruits every day. All right, and next is sleep. So people always talk about beauty sleep, and there's definitely some truth to that. I'm reading a great book right now. It's called Why We Sleep, and the author talks about how sleep is great for your memory, for agility in exercise and in sports, but it's also really amazing for your skin. It helps keep the skin looking smooth. If you ever notice after a bad night's sleep, your skin just doesn't look as fresh as it did. So it's important to keep up with your 8 hours every night. We're going to touch on collagen soon. I'm seeing some questions about that. All right, another tip I wanted to talk about with sleeping is making sure to sleep on your back. So imagine you're sleeping on your side like this, year after year. These lines that you create as you're sleeping that way can actually become permanent wrinkles. And for the ladies that are a little bit heavy chested, if you're sleeping on your side like this, you can actually develop wrinkles between the breasts. So sleeping on your back really helps prevent some forms of wrinkles and is healthier for you. All right. That was it for my general wellness tips. I got a ton of questions on acne and acne scarring, so that's what I wanted to talk to you guys about next. So for acne-prone skin, it's really important to wash at least once, if not twice a day. I really like cleansers that have benzoyl peroxide in them. These can be purchased like at a CVS or a Walgreens, and benzoyl peroxide is a great acne fighting ingredient. It can bleach your towels though, so make sure you're using white towels when you're drying off. It will not bleach your skin or your hair. Another great ingredient for acne-prone skin, but also for aging skin, is a wash that has AHAs and BHAs in it, and these stand for alpha and beta hydroxy acids, like glycolic acid or salicylic acid. These are basically chemical exfoliants, and they work to take off a layer of dead skin cells and make your skin look more radiant. They also unclog pores. So that's step one. Make sure you get yourself a moisturizer that's oil-free. And when you're buying makeup, look for makeup that says it's oil-free or non-comedogenic. That means that they've been tested and do not have ingredients that clog pores. All right, when you're putting your makeup on, make sure it's all coming off at the end of the day. So I like to do what's called a double cleanse, meaning I take off my makeup twice. I use a Neutrogena makeup wipe to take off the first layer, and then I clean up whatever's left with a glycolic cleanser. This is what I'm using now, and I love it. It's a vitamin C and glycolic acid cleanser made by DermaDoctor. You can buy it on Sephora. It's interesting because you don't need water, actually. You just put a couple pumps into your hand, and then the cleanser actually takes all your makeup and mascara off, and then you just wash it all off with water. It's a nice product. Okay, so we talked about washes, moisturizers, makeup. So let's say you're doing all of these things and you're still getting breakouts. My favorite product is Differin. This is an over-the-counter product. It falls under a category of retinoids. So retinoids include Retin A, Differin, retinols that you hear about a lot. And even if you don't have acne, Differin is a great product to use on your skin because it's anti-aging. So it works for acne by unclogging pores and preventing new breakouts, but it also has been clinically proven to prevent fine lines and wrinkles. So it's something everybody should be using at nighttime. I use a prescription strength retinol. I use Retin A. So the way you use it at nighttime on a clean face, you put just a pea-sized amount on the tip of your finger, and you want to dab in 4 places on your face and then rub it in. I recommend using it every other night for 2 weeks because it can be kind of drying, so you want to let your skin get used to it. And then after 2 weeks, if you're feeling okay on the cream, then bump it up to nightly. And for my Assyrian ladies who are waxing their eyebrows or their face or getting threading done on the face, stop your Retin A, your Differin, your retinol a week before you do that because it can cause skin breakage if you don't stop it and then get a wax. Okay. So if you're doing all of these things and you're still getting breakouts, it might be time to see your dermatologist and get a tailored prescription regimen for you. And these can be oral medications or topicals, depending on the type of acne that you have. Another thing that I think not a lot of people know about that I wanted to go over was prepping for a special event when you're acne prone. So there's a couple things that you can do to help with preventing acne. One is if you do get a big acne bump, you can actually call your local dermatologist and go in for a cortisone injection, which will flatten that big bump within 24 hours. If you're getting ready for a really special day, like your wedding day, or you're a model who has a photo shoot and you want to make sure you don't get any breakouts, talk to your dermatologist about a short course of low-dose steroids that can actually help prevent acne for a few days after being on it. I use this a lot in my patients who are brides or actresses. All right, and then I wanted to talk to you guys about acne scarring. So there's 2 types of acne scarring. There's indentations, and then there's pigmentation left over from an acne bump. So for the indentations, these are actually divots that you see in the skin from a really bad inflammatory acne cyst. Unfortunately, there is no cream that will get rid of those dents. Don't waste your money on creams. You need either lasers, chemical peels, or a combination of the 2. And it's important to see a board-certified dermatologist to talk about your treatment options, and they will be able to tailor a treatment plan for you to get your skin looking as smooth as possible. Now, for my olive-skinned patients, you all know when you get an acne bump and you pop it, it leaves a brown or a pink mark there that lasts for 9 to 12 months, and it's more annoying than the acne bump itself. And that's just because we have more pigment in our skin, and so pigment deposits anytime there's inflammation on the skin. There's a few things you can do at home for this. One of my favorite products for this is something containing azelaic acid, and these can be found over the counter. There's also prescription strength ones. Glytone makes a great cream with azelaic acid in it. You can use it twice a day, and it helps lighten pigmentation in olive or darker skin tones. Vitamin C serums really do help brighten the skin. Your Differin or your retinol is going to help with this as well. If you're doing these and you feel like you're not getting where you want to be, it might be time to see your derm to talk about starting a bleaching cream or doing a series of chemical peels to lighten up those spots. Okay, next topic I wanted to talk about are a few things that every person, man or woman, teenager or older, should do to help protect their skin and keep it looking as nice as possible for as long as possible. So the regimen you should be on every day, and this is the simplified version. You can always make it more complicated with different things, but these are the essentials. You want a vitamin C serum in the morning. So in the morning, you want to wash your face, and on a clean face, apply your vitamin C serum. Vitamin C is a great antioxidant. It helps with radiance and brightening the skin. So a few that I like, this is a cult classic. It's made by a company called SkinCeuticals, and it's a CE ferulic serum. The one that I've been using lately that I'm obsessed with is made by a company called Revision. We carry this in our office, and it's a medical grade line. It's a vitamin C 30%. I just bought this. I'm excited to try it. I've heard good things. Obagé's line, it's a 20% vitamin C. So I'll let you know how I like that. All right, so after you do your vitamin C in the morning, put your moisturizer with sunscreen on. You've got a lot of options here. A few that I like, this is a drugstore brand, Neutrogena Healthy Defense. It's an SPF 50, great for every day. It blends in nicely. If you want something that's tinted, Revision IntelliShade makes a really nice tinted sunscreen, and this is in Allure, and a lot of other magazines rave about this. And then lastly, this one I like when I'm out at the beach. It's made by SkinCeuticals. It's an SPF 50 that's waterproof, so this is a good one too. And again, with sunscreens, you can't go wrong. You basically just want to be using something that you like to use and will use consistently. All right, moving on to the evening regimen. You want to wash your face. Again, if you're acne prone or worried about aging, I recommend something with glycolic acid in it. If you're more on the dry side, you can do a creamy cleanser. There's a company called Nia24, Nia24. They make an amazing creamy cleanser, and it has niacinamide in it, which actually is an anti-acne ingredient. So wash your face, dry it. You're going to use your retinol or your Differin or your Retin-A, whichever one that you have. And then right over top of that, you want to use a moisturizer. Anything is fine. So there's drugstore brands like CeraVe PM, which is great. I've been using Revision's DEJ face cream for probably 2 years now. It has some anti-aging peptides, and I love the way it feels on my skin. And then over top that, especially in the winter months when the weather's a bit drier and your skin is drier, I do like a hyaluronic acid serum. Hyaluronic acid basically draws water to it, so it helps hydrate and moisturize the skin. And again, a few different ones I like. Neutrogena makes a great Hydro Boost that has HA in it. Dermadoctor from Sephora makes it's called Wrinkle Revenge. It has HA in it. And then this is another one, SkinCeuticals HA Intensifier, and it's a great one too. So again, different price points, different stores, different brands. There's not one that's better than another. It's just what you feel like suits you on your skin. All right. So then I wanted to talk about some skin tips now that we're in this crazy pandemic. We're all at home, we're doing our Zoom phone calls, our Zoom meetings, we're on our tablets, we're on our laptops, we're on our iPhones, and we talk a lot about UV light causing skin damage, but nobody really talks about visible light, and specifically blue light that's emitted by all these electronics that can actually cause a lot of photoaging. Normal sunscreen does not block blue light. So if you're using your sunscreen, you are still getting blue light, which is still contributing to wrinkling, freckling, and skin cancer. The only thing that blocks blue light or visible light is a tinted moisturizer with sunscreen. So that tint is created by iron oxide, and iron oxide creates an extra barrier to protect your skin from blue light. So something to keep in mind when you're on those phone calls or those Zoom meetings all day, protect your skin even if you're not going outside. And a tip for my melasma patients, blue light can also exacerbate melasma. So for you guys, it's very important to do the tinted sunscreen every single day. All right, next for coronavirus stay-at-home tips. You probably have never gone so long without having nail polish on your toes, and I do a lot of virtual visits every day with patients, and one of my most common complaints is toenails. So patients are finally seeing their toenails after years and years of putting on polish, and you're looking at them and you're like, oh my God, they're so yellow. There's this weird white crust on them. I know I have a fungus. 9 times out of 10 though, it's not a fungus. It's actually just the really harsh chemicals from years and years of polish, and all that scrubbing that your nail technician's done, it really damages the nails. So what is actually great for this and can help reverse that yellowing and that white crusting is Magic Eraser. It's a cleaning tool. I think the brand is Mr. Clean, but it's just a white sponge, and you can gently rub that on your nails and they will look good as new. So try that out. Okay, another thing that we're seeing a lot in this pandemic is maskne. So it's acne caused by the masks that we're all wearing. And basically what's happening is you're just breathing in and out your own air, and there's so much bacteria and moisture there that it causes irritation, and it causes clogged pores, which lead to acne. So what I'm recommending for these patients is not a super harsh wash, because you're already a little bit irritated, so you don't want to do anything that's more irritating. I like a salicylic acid wash. A 2% is fine, or a sulfur wash every day. These are antibacterial and anti-acne, but more on the gentle side. And make sure that you're moisturizing. Your skin needs moisturizing to help repair the barrier to protect it. So if your normal moisturizers are not enough and you're still irritated, you can do an over-the-counter cortisone to calm down any spots that are red, flaky, crusty, itchy, or feel like they're burning. If you're going to be at home or walking outside and not near a lot of people, it might be better to do one of those handkerchiefs that are loose around the jawline so that you're letting this area breathe. Okay, any other tips for coronavirus? Oh yes, so we're all washing our hands a lot right now, and a lot of patients are getting eczema breakouts or dry, cracked skin on their hands. And what I love for this is a good moisturizer. So let's see. I love Aveeno's Eczema Therapy, it's a cheap option for you. It's a drugstore brand. Put it on your hands and put it on your feet. Every time you wash your hands, you should be moisturizing to help prevent dry and irritated skin. And what I love doing at nighttime actually is putting the moisturizer on and then putting a thick layer of Aquaphor, mine's almost out, Aquaphor or Vaseline. Put a thick layer on your hands. You can put a thick layer on your feet, and then put your socks on, and you can put socks on your hands too, and go to sleep. And I promise after a couple days of doing that, your hands or feet are going to be feeling very, very soft. Okay, so those are all my tips for coronavirus. I got a lot of questions from men and women about hair thinning. It's a problem a lot of people struggle with, and a lot of people take biotin to try to help their hair grow, and then they sort of leave it at that. Hair loss has a lot of different causes, so it can be genetic, can be stress related, but it can actually also be due to things going on internally, thyroid disease or anemia. So you really want to make sure anytime you experience hair loss that you do see your physician and make sure that you get some blood work to evaluate. If everything's normal internally, there's a whole host of things outside of over-the-counter supplements that you can take to try to stimulate hair growth. These include medical grade supplements like Viviscal, Rogaine, platelet-rich plasma injections. There's also an oral version of Rogaine, and there's other oral medications that you can take for hair loss, but it's important to get a regimen that's tailored to you, that is based on your type of hair loss. All right, and next I wanted to debunk some common myths that are out there. We've been hearing a lot about people using coconut oil all over their skin. It's terrible for you. Please don't use it. So it really clogs pores. I've had a lot of patients coming in with terrible acne breakouts because they wanted to go all natural, so they're using coconut oil on their face. Clogs pores. It's not great. It is nice to use it to help hydrate your hair, but if you're using it, make sure you're not getting it too close to the scalp, otherwise you're going to get hairline acne. All right, derma rollers. I don't know why people use these. Don't waste your money on it. You don't need it. And that 10 minutes you spend in the morning or at nighttime rolling your face is a waste of time. You could be doing much better things with your time. All right, another common myth is that everything natural is good for you. So I have a lot of people that get only organic products, or they want to make sure everything in their moisturizers and topicals is natural. And while that's a great aim, a lot of times these products have essential oils or nut oils in them, which are actually very, very pore clogging and very, very commonly cause allergies. So you want to find a balance between natural, but using things that don't have too many allergenic ingredients. A lot of people ask me whether or not they should be using toners. So toners are a bit outdated. They were initially brought about decades ago when our soaps were very primitive, and after you wash, they left this residue on the skin. Toners were created to basically get that residue off. Our soaps now and our cleansers are very cosmetically elegant. They don't leave a lot of residue on the skin, so you don't actually need toner. The place where I would say maybe it plays a role is if you feel like you're not getting all of your makeup off, then that's when I would say use a toner to get that extra residue off your skin. Collagen supplements have been huge in the past few years, and I think the Kardashians have something to do with that because they're always posting about collagen supplements and powders on their social media. And honestly, the jury is still out on collagen. So some studies show that it has absolutely no effect on the skin. There's been some newer studies actually that have been pretty interesting. They've biopsied skin before taking collagen supplements and then after taking collagen supplements. And they've actually shown that there's been increased collagen production in the skin. There's a lot of conflicting evidence out there. So I would say the jury's still out. If you want to take it, it's probably not going to hurt you. It's extra protein in your diet. But if you do take it, it may not work. But if you do take it, let me know what you guys think. All right, the last thing I wanted to talk about was this myth that the more money you spend, the better product it is, and that's absolutely not true. So I've shared a lot with you guys drugstore brands. These are $15 and under. Some of the products are in the $80 or $90 range that are not from the drugstore. It really just depends. You want to look more at ingredients than price. So that's where I mentioned the vitamin C, the hyaluronic acid, the retinol. These are the things you want to focus on more than price. If you spend $300 on something, it may not be as good as a $40 thing you can pick up at Sephora. It just depends. Okay, so that was everything I wanted to talk about. Now I'm gonna move over into the kitchen and we're gonna do a DIY face mask. So I'm gonna take you guys over. All right, so this mask is made out of ingredients that you guys should all have at your house. So we're gonna do, banana, yogurt, lemon, and my Ultra Fabi Sedaf turmeric. Okay, let me set this down here. Okay, so these products are great for both acne-prone skin and if you want to just brighten things up a little bit. So the yogurt has lactic acid in it, which is similar to glycolic acid. It removes that extra layer of dead skin cells and it helps with radiance. And you just want to do a spoon of this. Lemon is also filled with AHAs and BHAs, which help with exfoliating. So just squeeze that in with the yogurt. All right, turmeric has a really powerful antioxidant in it called curcumin. And as we know now, after everything we talked about, antioxidants are really important for keeping your skin healthy and they actually reverse ultraviolet light damage. So you can pour just a little bit in there. It doesn't have to be an exact science here. And then lastly, banana. We're actually going to be using the inside of the peel. It has a ton of nutrients and vitamins in it that are great for skin health. So you want to just peel your banana, and this might be a little bit tricky, but kind of try to scrape the inside. And whatever you get, you can put into the bowl. And I do like to put a little bit of the banana in there too. The sticky texture just kind of helps the mask stick together. I don't want you guys using this if you have any allergies to any of these ingredients or you have sensitive skin. And actually a tip for people with sensitive skin, if you find that you react to a lot of products, the best thing to do when you pick up something new is to actually test it on the inner crease of your arm for 3 days. So let's say you pick up a new sunscreen or a new moisturizer, put a little bit in the crease of your arm because this skin is really thin and sensitive. You'll do that once a day for 3 days. If after 3 days you don't have a reaction, it's probably fine for you to use that product. Okay, so then you're basically just going to mix this all together. Make sure you get those little bits from the peel in there. And this has like a nice kind of sticky texture. And this is a lot. It's probably good for 2 or 3 people. And you can put it all over your face. If you want to do it on your neck and chest, you can as well. And leave it on for 20 to 30 minutes. Wash off with your normal cleanser and then moisturize. And I think within 24 hours, you should be feeling like you got a little bit of a chemical peel. That lactic acid in there from the yogurt is great for that. And I'd love to hear what you guys think on this. That is all I had prepped for you guys today. If you have any other questions, my office is open. I'm seeing patients and I'm happy to see you. You can reach out to me. And if you guys have any questions, I'm happy to answer them. As I was talking, I wasn't able to focus totally on the questions you were sending in. So if you have anything, please let me know. You're very welcome. Okay, guys, it doesn't look like there's any questions. If you need anything, you can always message me later through my own Instagram, oharaavaz.md. I'm happy to talk to you guys, see you in the office, and I'll be posting this later on with some links to the products I love. Have a great Saturday. Bye.